Symptoms of hypoglycemia. What is the proper treatment for low blood sugar? Hypoglycemia is any time a blood sugar is lower than normal. This can be different from each person with diabetes, but it usually means blood sugar less than 70. Symptoms to look out for include tiredness, increased appetite, cloudy thinking, blurry vision, an inability to concentrate, pale facial complexion, sweating, unresponsiveness or decreased ability to respond, confusion, and agitation. Once see these symptoms, it's important to immediately test the blood sugar to confirm if in fact experiencing hypoglycemia. Some of these symptoms are also characteristics of high blood sugar levels or hyperglycemia and may be felt anytime there is a rapid drop in blood sugar. For example, if the blood sugar is high and you give insulin to bring it down, you may see the symptoms commonly associated with hypoglycemia as the blood sugar dips, even if it usually actually isn't low by definition. How should low blood sugars be treated? Once you confirm the blood sugar is low or lower than normal, you'll want to give fast-acting carbohydrates, simple sugars with little to no fiber. You'll also want to avoid high-fat foods. The fats that will often stabilize blood sugars after meals can actually delay how quickly the body absorbs these needed simple carbohydrates. In case of low sugar, that's the opposite of what you would want to do. If a blood sugar is greater than 80 but less than 100, but you're seeing signs and symptoms of hypoglycemia, the best thing to give is an all-natural peanut butter with no added sugar. If the blood sugar is greater than 80, it's likely these symptoms are due to rapidly changing blood sugar levels and aren't in need of quick-acting carbohydrates. Peanut butter or any nut butter without added sugar is filled with protein and fat and can help alleviate this system without raising blood sugar more. If blood sugar is 70 to 80, peanut butter and crackers. At this point, the blood sugar is still not technically low by definition. However, this may be lower than you're comfortable with. Any form of starch, in this case crackers, will help gradually rise the blood sugar just slightly, and the fats and protein in the peanut butter will sustain these levels. Quick carbohydrate guide for treating low blood sugars. If your blood sugar is less than 70, you'll need 15 to 30 grams of a quick absorbing carbohydrate like the ones listed below. Each of the following provide 15 grams of carbohydrates. Lifesavers, honey, jams, maple syrup, 1 tablespoon sugar and water. Beverages are apple juice, orange juice, pineapple, soda, grape juice, cranberry, prune, and fat milk. Fruits are bananas, apples, oranges, applesauce, 2 tablespoons of raisin, 15 grapes, or 3 to 4 glucose tabs, 1 tube of the glucose gel. The foods listed above are easily absorbed and will raise blood sugar levels quickly. Food that contain protein or fat, such as chocolate, candy bars, ice cream, cookies, crackers, and bread, don't raise the blood sugar quickly enough. If blood sugar is less than 55 and able to respond, if blood sugar has dropped below 55, you need to give quick, rapid-acting liquid carbohydrates. There should be no fiber, fat, or protein present. Grape juice is one of the highest carbohydrate-filled juices. Some people have trouble swallowing and chewing when blood sugars reach this level, so we want to focus on concentrated sources of carbohydrates like higher carbohydrate juices, sweeteners like maple syrup and honey. If blood sugar is 55, or resident is not responding and unable to take anything orally, get the glucagon injection. Check daily to see if the glucagon is available and not outdated for diabetics. For all instances of treating hypoglycemia, it's important to wait 15 minutes prior to rechecking or redosing with more carbs, as will rebound with high blood sugars. Give additional 15 to 30 grams carbohydrate, wait 15 minutes and recheck the blood. Example, at 7 a.m. blood sugar was 45 and resident responsive. Gave 1/2 cup orange juice and rechecked blood sugar. 15 minutes later, blood sugar was 75. Doctor updated on blood sugars and current insulin orders and document any new orders. Always check doctor's orders on parameters and when to give the insulins and when to hold. Again. With every 15-minute blood sugar checks, you must chart them and also make a progress note of what the blood sugars were and what you did regarding blood sugars and when doctor was notified of low blood sugars and if any new. You must document everything and times from the beginning to the end. This is a must. Remember to calibrate the AccuCheck machine with each new bottle to strip and date them. This is not done on night shift anymore. Also remember to clean each blood sugar machine in between the use of residents and before and after when putting it away. That if you take anything out of there, you need to replace them. Call Gay and tell her what you took out so the items can be replaced. These are what our diabetic kits are. They are stored in all the bedrooms on each station. Gay has put them together. There's a list on there. There's also sheets in there. Also, we have a AED. It's located by Activities Office. If you use the AED, please let Ashley know right away.